Our next speaker is Jovita Murillo, who received a doctorate in public health from Claremont Graduate University. Her research interests involve exploring the intersectionality between social determinants of health and health disparities.
Hello, everyone. Hello, everyone. Given that my talk is on gender inequities, happy Women's International Day to us. All right. So my research is on the social impacts that the COVID-19 pandemic has had on women. This is in partnership with the Los Angeles Commission for Women, specifically the Health Committee. And we report our findings, and we're actually going to report our findings to the Board of Supervisors. We work directly with the Board of Supervisors of Los Angeles. So background information, we know that gender inequities already existed globally, nationally, locally. With the COVID-19 pandemic, gender inequities exacerbated. We know that women have maintained the highest levels of job loss. I don't know if you've seen the statistics recently, but women haven't returned to the workforce. Again, women have not returned to the workforce. We don't have the same rates that we had in 2019. Food insecurity, housing instability, intimate partner violence, and financial uncertainty are among some of the social factors that women have experienced or report experiencing during the COVID-19 pandemic. And we do know that social determinants of health have contributed to women's poor health outcomes before the pandemic. Here's the social determinants of health framework. This is from the Kaiser Family Foundation. I'm not going to delve too much into it, but basically it lists all the social factors that impact health, like now having access to affordable housing, not having access to food, not having access to safe parks, not having access to transportation, maybe transportation being too expensive, right? And so forth. The problem is that we know the COVID-19 pandemic has exacerbated social determinants of health. It has been well documented that social determinants of health influence women's health. However, what is missing is how the COVID-19 pandemic has affected or exacerbated social determinants of health for women compared to men, including those that are married and not married. Now, my research questions were, did women experience more adverse social impacts from the pandemic compared to men? And among women in different types of partnerships, married or not married, was there an association with social impacts from the pandemic? The data sources, we already know what the data source is, but we specifically made it, restricted our data to respondents in the Los Angeles area. The survey was administered in wave 28. Which was May 12, 2021 to June 22, 2021. The original sample had about 1,117. We lost about 12% of the data, given that we restricted the data to just Los Angeles area. We went ahead and we did a multivariable logistic regression model to examine associations between social impacts by gender and partnership status. We adjusted our models by race, age, ethnicity, and employment. And we define partnership as married or living with a partner, and separated, divorced, widow, and never married were considered not married. So given that this is, we did this study in partnership with the Los Angeles Women's Health Committee. The committee actually knows people at USC. USC then allowed us to add 4 questions. I'm going to be presenting on the 3 of those questions. And those questions were, since March 2020, how often has financial difficulties brought on by the COVID-19 pandemic affected your physical or mental health? Since March 2020, how often have financial difficulties brought on by the COVID-19 pandemic forced you to delay payment of housing, of health expenses in order to afford your housing expenses? And since March 2020, how often have you experienced housing insecurity due to financial difficulties brought on by the COVID-19 pandemic? And all of these questions were created by the committee. We used a Likert scale, and we went ahead and we recoded the values to determine, one, if there was even any social impacts that women experienced. And we recorded that as 1 and 0, 1 being all the people that report or respondents that reported all of the time, often, sometimes, or rarely. 0 was considered never experienced any issues. Frequent issues, we figured if we asked who had more frequent issues, and we're going to determine which ones were the most persistent social factors that influence women's health. We coded that as one all of the time and often, and those are reported never, rarely, and sometimes were labeled as did not experience frequent issues. Our results, about 60%, 60.4% of our sample was women. Most of the women were racial and ethnic minority women. We had about an even split when it comes to low income. We had about 38.9% that reported making less than $39,999. And then about 35.5% that reported making more than $75,000. And again, this is household income. Most of our participants were between 35 and 54. The second biggest group was the ones reporting 19 to 34 years of age. For men, we had about 39.5% that were part of the study. It looks like we had about an even split as far as minority men. Most of the men reported higher income with 75,000, making more than 75,000. And most of the men were about the same age that women were in our study, between 19 to 54. When we look at social impacts by gender, we found that the odds of the woman experience social impacts, but not so much frequent impacts. Those reporting housing insecurity had an odds ratio that was higher for women than men. And again, right, we didn't see so much with more frequent social impacts. And then when we looked at social impacts by partnership status, what we ended up finding is that those reporting financial difficulties that affected their health were higher among women. The odds ratios were higher among women than men. Those reporting more frequent financial impacts or difficulties were higher among women that were not married. Again, right, we see the same pattern as any compared to married women. And basically what we find is that, again, right, women experience more social impacts brought up by the COVID-19 pandemic, but not necessarily more frequent issues. Those reporting more frequent issues were women experiencing housing. And if you know anything about the Los Angeles area, you know that the women that are experiencing housing insecurity it's not just any kind of woman, it's really just racial and ethnic minority women experiencing housing insecurity in Los Angeles. For unmarried women, we found that those reporting more social impacts were the ones reporting financial difficulties. One of the things that we suspect is happening is that that it's possible that unmarried women are experiencing more financial uncertainty since they do not have a partner to buffer those financial challenges. Given that most unmarried women were racial and ethnic minorities in our sample, it is likely that existing racial and gender inequities are influencing the way that they experience social impacts during the pandemic. And, it really just aligns with the research that is out there about housing insecurity and finance and the impacts that the pandemic has had, right? That the women that have experienced the biggest burden of the COVID-19 pandemic have been racial and ethnic or women of color. And then my limitations, there's a lot of recall bias. I mean, we asked the participants to recall their experiences from March 2020. It was self-reported data, and it is likely that the survey, that since the survey was administered, there's now more resources, programs, and initiatives that maybe have helped women. And in conclusion, anything when it comes to women's health, I feel we need to use an intersectional approach. Women's health doesn't happen in a vacuum. We know that race and ethnicity influences women's health. We know that socioeconomic status influences women's health. We know that even their geographic location, their immigration status, all of these things need to be considered when it comes to women's health. To get to the core of the issue, we just really need to start working on gender and racial pay gap. Most of the women that are, if you look at the pay gap, the women that are making the least money are African-American women, Latina women, and Native American women. We need to extend the COVID-19 relief initiatives like safety net programs to all women, including those that are married. I believe that in the beginning, especially now, most of the COVID-19 relief programs have been specifically made for women that have children. And women are more susceptible to the effects of natural disasters. We know that, global threats, research shows that. So we need better measures to protect and preserve the health of women locally, nationally, and globally, especially because we know that there's a social gradient of health that shows that if you're low income, your health is going to be poor. If you're higher income, your health is going to be good or decent.